So we take care of a lot of folks that have knee pain. Knee pain is very, very common in our world. One area that I thought that is interesting, and it's worth at least talking about, because it has thrown a lot of patients off in my office, and they end up, talking to doctors. I'm sorry, just making the tibia longer, but this is a side view of the knee. This is a front view of the knee. What they'll find is they'll actually have knee pain down here. So if this is the medial knee, they'll actually have knee pain down here below the knee joint. And they're trying to figure out, and not over here lateral where that fib head is, because that can happen as well. But it's what we have found in the practice, and which is very interesting, is what it truly is. I mean, I've had a gal that basically they wanted to operate on her knee. They wanted to replace her knee because of this pain. But the problem is it wasn't even in her joint. Her joint actually didn't look that bad. So what they were going to do is cut on a joint that they didn't even know what the problem was. And she did not want to have a knee replacement. So we did some digging. We tried to figure out exactly what was going on. And we figured out your knee pain isn't even in the joint. It's below it. And so you have a muscle that comes down. It's called the sartorius muscle. It's a very, very long muscle in the front of the leg that crosses the knee and then attaches down the tib. And so you can have a tight sartorius. It's kind of like having a tight quad and a tight hip flexor, but it's attached a little bit lower. And so you'll have this pain low down on that leg, in that upper tibia area, that upper lower leg. And nobody can figure out why or figure out what to do about it. And then realize that it's this muscle that comes down through the quad or through the front of the upper leg, crosses the knee. And so it helps to flex the knee a little bit, stabilize the kneecap. But getting that elongated is actually what we did with her. We stretched it, we vibrocussed it, we basically got that knee to open up. We did some things for anti-inflammation, for laser, etc., around that area, just to help to chill it out, that insertion point of that muscle. And she did great. So pay attention to where the knee pain is. Again, we have other videos on that. But if it's below the knee, there's a couple things, but one is going to be this potential here. Others, again, then pay attention to when it comes on. If you have knee pain down more, it seems like it's almost like below the joint, then there could be more serious issues if it comes on at night. So pay attention to that. If that's what it is, find a doctor that knows what they're doing so they can make sure and take good care of you.